a movement therapist who specialises in hypermobility, EDS and chronic pain. And it's EDS and HSD Awareness Month, the month of May. So today is our usual live event. Normally I do some education and we talk about a particular topic, but today we're just going to move because we're going to celebrate EDS and HSD Awareness Month. We're going to kind of focus on body awareness. So if you're looking to connect with your body, we're going to do some really gentle, lovely movement, and we're calling it EDS HSD Body Awareness. So this is a movement special just for today. And then on the first Thursday of June, we'll be back to our usual format where I'll be doing some education and some movement. Hi Lorna, yeah, give me a wave, let me know who's here. It's really lovely to see you all. And don't forget, stick around till the end because there is a very special announcement at the end just for EDS Awareness Month. So if you're watching this video back and you're not watching it live, watch it until the end. And this announcement will only be available for the month of May 2022. Okay, hello, lovely to see you. Yeah, thank you all for giving me a wave, that's really nice. So I said you don't need any special equipment today, so I don't have anything, but if you need cushions, you need support, you need balls, bands, whatever you might usually need for your movement practice, feel free to use those. I'm just not going to use them today. We're just going to be kind of free flowing. As always, if there's anything that doesn't feel right to you, not suitable for your body today, or makes your pain worse, please don't do that particular exercise. So please look after yourselves. Leave me any comments in the box below afterwards. Obviously I can't look at the screen while I'm teaching, but have fun and enjoy this EDS HSD special movement class. So I'm going to take these off, so I won't be able to see you now anyway, but enjoy the class. Let's get going. So I've got my little sheet here because I've created a lesson plan, so I didn't want to forget anything. So hopefully, let me just check. Yeah, I'm just going to move the screen down a little bit so you can see me better. Just move that down. There we go. And get that out of the way. There we go. Hopefully you can all see me. Okay, so as I said, grab whatever you need, cushions, blankets, extra support, and we're going to go ahead and lie down. So remember, today is all about EDS HSD body awareness. So I'm going to be talking a lot about sensing your body and feeling your body and connecting with it in a very nice way. Should feel really, really good. Okay, so you can do this in bed as well, of course, if you don't like being on the floor. So take a moment to get yourself settled. Now, you may have seen my post earlier this week, which I did with Dr. Linda Blunstein, the Hypermobility MD. We were talking about alignment and why alignment is so important. Because when we start to feel our bodies, we start to get a sense of where our bodies and our bones are, we'll start to have better alignment of our bones. So if I'm lying on the mat and my shoulders are up here, which to be fair, many of us are, okay, here, my shoulders are raised, I don't have good alignment of my joints. Yeah, I'm going to have a lot of tension in the front of my body. These muscles are being stretched really thin. So if you are lying here and you're like this, what I would suggest you do is get a towel or something, a cushion, put it under this shoulder or both shoulders so that this shoulder can start to drop back and relax. So over time, this drops back, you start to have a lot more awareness of where the shoulder actually wants to sit. Okay, so that when we stand up, our shoulders are here rather than rounded forward. Okay, so I mentioned in that post that spending a lot of time on the floor or in the bed, wherever you're doing this, can be really useful because gravity can help you drop and settle your bones into alignment. Okay, so hopefully everyone's on the ground, we've got ourselves settled. We're just going to take a moment to close the eyes and just focus on our breath for a moment. So without judging, without forcing, just letting yourself settle. And if you've been at work today, or you've had a stressful day, or you're just starting your day, just take a moment to notice how you feel. What sort of a day have you had? Can you feel the tension? Maybe you're gripping at the front of your thighs, or maybe your abdomen, or maybe your chest. We'd all sort of hold our tension in different places. So start to become familiar with where you might be holding tension. So yeah, if you're someone who grips around the front of your hips, let's invite our hips to soften. So we're just going to say, as we exhale, can I soften the tissue around my hips? What does that word soften do to your pelvis? So if you soften your hips, does that create a sensation of release across the pelvis into the back of the pelvis? Can I soften my shoulders? So what does that do? Does it allow my shoulders to just drop back a little bit? Can I soften my breath? So can I make my breath quieter? So that no one else can hear me. If there's someone else in the room with you, they shouldn't be able to hear you breathing. So it's so quiet, so gentle. And I just want you to sit with that for a moment, just noticing how that feels. Some of us might find that quite, challenging, just to be and be still. It can be quite challenging, and that's okay too. Okay, so don't judge, don't worry about it. Now, I'm going to put my hands on my pelvis. We're going to start gently moving the pelvis. What I want you to try and do, remember we're trying to create body awareness, so I want you to try and just think of moving the weightiness of your pelvis. So really feeling, as I tip my pelvis forward, and I get a little arch in my back. It's not very big. And then the weight of my pelvis rolls back and I flatten my back. Okay, so I'm literally feeling the bones rolling across the mat, creating a bit of space, and then the weight rolls back. What we're not doing is this. I'm not using excess muscular force to move my pelvis. And you can see my whole body is moving. It's not very comfortable. So what I want to do is just gently, quietly roll the pelvis. Very soft. How soft is this tissue? Because how many of us have back pain? Yeah? How many of us have a tight lower back? How many of us have SI joint issues? Potentially. Is that because the tissue is so tight and it's pulling on those joints? So softly, softly. Now, that might be enough for some of us, which is fine. Just keep going with that. If a pelvic circle is accessible to you without discomfort, we're going to try and start rolling, and it can be a really small circle. So if I put a pencil on your sacrum, which is the bone in the middle of your pelvis, where your tailbone kind of comes out the bottom of it, could you draw me a circle on the floor with that pencil, however small? So I'm doing it. You might not be able to see me moving very much because it's very delicate. I'm not doing this. So my legs are not moving, I'm not moving. I'm just moving those very heavy bones, and I'm going to go the other way. Again, you might find it sticky in some places. Do not push into an area that feels tight or sore. Just gently move with it. Move around it. Do not force yourself into any particular position. And then just come back and settle. And invite softness again into the legs and the pelvis and the belly. Now from there, I had a request actually to introduce some work around forearms and wrists. Maybe a lot of us are doing computer work, or we get a lot of repetitive strain injuries. So we're just going to keep the upper arms still. Keep that pelvis soft and heavy, and just bend the forearms. So your forearms are vertical. Your elbows are still heavy on the floor. Hopefully so are your shoulders, so your shoulders haven't come off the ground. Now, from here, again, take it easy if you have, very flexible wrists. Take one arm, doesn't matter which one. Start to draw a very small circle. Bit like we did with your pelvis. So we try to be very quiet. So notice how slowly and delicately I'm moving my wrist. I'm not doing this, which I can because I'm very mobile. I'm going to make it very small. And I just want to see how that feels, because it's amazing how much tension we hold in our forearms. And just reverse your circle and just see how it feels. And then just come to stillness. Now that motion will have translated all the way up the fascia, up into your shoulder. So you may have noticed that your shoulder feels slightly different. And then we'll do the other side very gently. It's almost as though there are no muscles to do it for you. Can you just move almost without any effort? Now while you're doing this, what's happening to your pelvis? Is it still heavy, or have you started tensing up? Remember, we're talking about body awareness today. And then still, let's go the other way. I don't think we went the other way. And then come to stillness, both arms vertical, see how you feel. Now from there, keeping softness in the wrists and the forearms, can you just float one arm up to the ceiling? Now remember, as this arm goes up, gravity is going to take the upper arm bone down. Okay, soft elbow, no hyperextending. So I've got one forearm up, one full arm up. And then I'm just going to keep that shoulder heavy, and I'm just going to bend it again. So I'm coming back down. Skin of the forearm is soft. Okay, because what we tend to do is do a lot of tension in here. Can you do it with some slidey, glidey tissue? So we go up, everything is soft and heavy. Notice how it feels. Just notice how it feels, and then feel the weight of the shoulder and come back down. Now we're going to try and do both together if that's available to you. If it's not, continue with single arms. We're going to go up. So both shoulders are going to drop into the floor. You're going to feel a heaviness, hopefully, around the scapula, the shoulder blade. The armpit is going to feel quite deep. So I'm not up here holding my arms up. The bones have dropped into alignment. So we're here with these vertical arms, hopefully quite heavy across our back and our pelvis. Now, what happens if we just move the arms back a little bit? Just maybe 2 inches. Notice that it feels different. There's a different dynamic. There's a different pull. What does it feel like? If it hurts, obviously come out of it. I haven't gone very far. And then bring it back and notice probably it feels different again because there are different forces. And what happens if I go forward just a little bit? Different again. I can feel my abdomen muscles now kicking in. Yeah? And then just bring it back to vertical. Feel the weight of the shoulders, soften the elbows and come down, and just lower the arms down and relax. Gently roll the head if that's safe for you to do, just to release any kind of neck tension that might have crept in there. Because remember, we're trying to move the arms from our backs. Yeah, so hopefully your neck isn't doing too much. It shouldn't be. Okay, so we've had bent arms. We're now going to have straight arms. Remember what I said about holding tension in the forearm? Can you, moving from the back of your body, lift the arms off the floor, even if it's just, a couple of inches? And then with that soft skin here, soft, no locking. Yeah, so many of us try and move our arms with locked elbows. Keep it soft. Now you're really going to have to use your back muscles, which is what we want. I'm just going to float them up. Now when I'm here, which is where we were just a second ago, is the pelvis still heavy? So just check with yourself. And then you're going to float the arms with soft skin, soft forearms, all the way back down. Collarbones wide. And again, soft. Don't lock those elbows. Find a weightiness through the back of your shoulders, soft skin. How does it change as the arms go further back? Have you still got that support? Is your pelvis still heavy? Are you still breathing? How many of us hold our breath? I know I do sometimes. Really important that we keep breathing. And then we're just going to float up one last time. If 2 arms is too much, please just do 1 arm at a time. It's perfectly okay. So now I'm here, arms vertical again. I'm going to rotate the arm bones, not just the wrist. I'm going to rotate the arm bone so my palms are facing each other. We're going to do some little shoulder glides, single and double. So here's my shoulder blade. I'm going to lift it off the floor a little bit. So now I've gone into that rounded position. So I've inhaled and I've lifted my scapula off the floor. As I exhale, the weight of the shoulder blade is going to come back down. Okay, so I control it, but I'm dropping it with control. So I'm going to do the other side. I'm going to inhale. Can I lift my other shoulder blade off the floor? And then do I feel how heavy that shoulder blade is as I come back down? Now this is really important for awareness of where our shoulders and our arms belong. Soften that elbow. I just caught myself doing a little attempt at locking there. So inhale to go up. Exhale heavy. Feel your shoulders. Let's try both together. Inhale up. So I've gone into this rounded shoulder position that many of us have. Soft elbows. Where's that weight through the shoulder blades to bring the arms back down? Very heavy. And again, inhale up. Exhale heavy. Very good. We're going to lower the arms down. So if you need to relax, just bring them down. Just relax the hands and the fingers. Very good. So we'll give our arms a little rest. Again, roll your neck a little bit if you need to, if your neck was trying to get involved. And of course, the roll muscles will try to get involved initially because we have these habits of doing things. So it takes time to replace old patterns with new patterns. So don't worry if you're like, oh, I can feel my neck or whatever working. That will change over time. Okay, so we're coming back now. Drawing our attention back to our pelvis. So we've settled, the shoulders maybe feel a little different. Can we draw our attention to the pelvis nice and heavy on the ground? Now just put your hands in the sort of crease of your hips. So right in there, in that hip crease, because we're going to go into a knee roll. So what happens when we knee roll? Oftentimes we try and pick the leg up. Now when I try and pick my leg up, I activate a lot of this tissue at the front here, so I get quite grippy. Okay, what we actually need to do when we move the joint is think of widening the joint. Okay, so that what the thigh bone really does is it drops and rolls into the socket. But this joint has to get the sensation of widening for that to happen. Okay, so the thigh bone, if you've never seen one, obviously is a ball and socket joint, so it literally drops and rolls into the socket. So then this is still soft, I'm not gripping in my hip. And then I'm just going to roll it back down. Okay, so have a little play with that. If you keep your hands in the front of your hips, it just gives you a sensation of widening and dropping the thigh bone. So that this is really not super engaged. Pelvis is still heavy. If you've got a heavy pelvis from that earlier work, it's much easier to get that sensation. If you haven't yet dropped the pelvis, it's going to be a little bit harder. But again, this could be work in progress, so just be aware of it. This is all about body awareness. So there's our knee rolls. Okay, now we're going to add back in the arms because we're going to turn it into a dead bug. So as I float and drop and roll the thigh, I'm going to drop and roll the shoulder. Can you see how they work in the same way? This is also a ball and socket joint. They both drop and roll. So they both roll back down. Practically, functionally, the body is designed to make movement easy. We have these ball and socket joints so that things can roll and drop and glide. But of course, when we have tension, when we've been in pain and we start gripping, and maybe we're out of alignment, that gets a little bit harder. So what we're trying to do today is just get a sense of this lovely gliding and rolling sensation. And I do a lot of rolling in the classes in the Zebra Club. We have, a whole section where we just literally roll around doing this sort of thing, and it's very nurturing. The body loves it because it's very natural for us. So there's our dead bug. We'll have a little rest. Now, just take your arms out a little bit wider, turn the palms up, and we'll just do our windscreen wipers. So we're going to do a little supine rotation. I'm going to roll to the side. Again, not collapsing, because you see if I collapse, I'm just pulling on my lower back and my hip. That's not going to be very helpful for us. So I'm going to roll onto the other hip, but I'm not collapsing. And then I'm going to roll it back, feeling again the heaviness. Can you feel the weight? That's what brings you back. Remember, we're dropping and rolling. I don't need to pull myself back because this thigh bone is going to drop back into its socket. So I don't really need to do an awful lot of effort. If I understand the mechanics and the rhythm of the bones, I don't really need to use a lot of muscular effort at this stage. I can just roll. It's not like we're, I don't know, doing a plank or whatever. We're doing some very nice, nurturing, rolling actions. Okay, one more time. So we're dropping and rolling, dropping and rolling. Very good. Okay, bring your feet, if you took them slightly apart, bring them back in. Hope you're all with me so far and enjoying the class and it's making sense. So, I'm going to go into a really lovely exercise to wake up the feet. We haven't talked about our feet much, so let's give our toes a little wiggle. Let's wake up our feet. Let's maybe lift our heels alternatively. Just bring our attention down into the lower leg now. So, we're going to do one of my favourites. We're going to do a bridge. Obviously, if you've got a lot of head support, you put some cushions, you might want to get rid of some of your head support so that you're not sort of squashing your chin into your chest. But obviously, do what's right for you. You're only going up so that the weight's across those shoulders again. So remember, we spent a lot of time doing this and feeling the weightiness into our upper back. This is where this comes into use because I need to feel that again when I'm in my bridge. Okay, so we've also done pelvic tilting or pelvic rolling. So can I do my little roll so my back is flat? Now how about I transfer the weight now into my feet. So my feet now roll my pelvis up. Now it might be here, it doesn't matter how high you go. Remember, I'm looking for weight distributed between my feet and those shoulder blades or the back of your upper back. Certainly not your neck. Okay, so if you've gone up so high, we shouldn't be on our neck. Now we're going to take a breath. And I'm going to soften. I'm still in my feet, but I'm softening, softening, softening all the way down. And that pelvis is going to get heavy again, like we did at the beginning. So it settles. And those creases come back into your hips. Here we go. Tilt. Now find your feet. Notice how the feet want to lift the pelvis up. Yeah, there's this communication through the bones to help lift us up. Again, so we don't have to use a lot of muscular gripping and tension. Weight is resting between my feet and my shoulders, the back of my arms. And I'm going to soften. Now, as you come down, of course, you have to start letting go. So if your glutes were switched on, as you come down, they're going to let go because your pelvis is spreading out and it's going to hit the ground and it wants to drop. Yeah, so if you're still gripping your bottom on the way down, you're holding that tension, it's going to be very hard to settle again. Let's just do one more. So I do my pelvic roll. So I flatten my back. Then my attention goes to my feet. The feet expand into the ground and they lift the pelvis up. Soft belly. No tension in the belly. Okay. Just make sure you're still in your posterior tilt. You haven't done this. This will hurt your back. If you've gone into a sort of a flat back, it's not very nice. So make sure your tail is still pointing towards the back of your knees. Take a breath. Now enjoy this, soften. You might be hearing some clicks and things are going on as you roll down your spine. Now remember, we're letting go and we're dropping and releasing. So the pelvis is heavy again. Just take a breath, let's just check in. Maybe you need to roll your head. Maybe you need to soften the ribs, whatever it might be. Now, I'm going to add in a little curl up today, so if you've got any sort of necky issues, certainly cranial instability, etc., please don't do this one, okay? If you want, you can just put your hands behind your head. We're going to do some butterfly arms to begin with, and then those of us that want to are going to do a curl up. Okay, so before we even do that, if we're all in this position, if this is accessible to you with your hands behind your head, let your pelvis feel heavy and just relax. So this is actually, if your shoulders are okay in this position, this is quite a nice relaxing position. It opens up the front of the chest. It's very nice for practicing belly breathing. Now, again, if your shoulders allow, we're just going to bring the elbows in and then gently open the elbows. So gently moving the shoulder blades. Again, I'm not doing a big movement. I'm certainly not pushing my arms to the floor. Even if I could get my arms to the floor, which I probably can, I'm not going anywhere near the floor. Then I want you to stop where you can just see your elbows out the corner of your eye. My hands are interlaced behind my head. Now, all we're thinking about, I'm not doing chin to chest because I'm not going to squash my neck. I'm actually thinking about the weight of this pelvis again. Because if my pelvis is heavy, as I exhale, I can slide my ribs towards my pelvis and my upper back comes off the floor. I'm not pulling on my neck, I can take my hands away. And then my pelvis is heavy and it allows my upper back to come back down. Okay, so just have a little play with that if you're doing this one. If you're not, just stay in this position and practice your belly breathing. Opening these armpits, it's very nice. But if you're doing the curl up, focus on the pelvis. And as you exhale, feel the weight. So the heavier the pelvis gets, the lighter my upper body gets. I haven't come up very high, I'm still just on my shoulder blade. So it's not a sit-up where you have to come up a long way. Let's just try one more. What we're not doing is this. Try not to pull on your head. People try to pull to get themselves up. That's just going to strain your neck. The curl up comes from here and the ribs sliding down. Then you have no choice but to come up. But if you try and do it from your neck, it's not going to be very nice and people always say their neck hurts. So it's the ribs sliding down. Okay, pelvis is still heavy. And then back down. Release your arms back into a little V. Gently roll your head. And then we'll just do another windscreen wiper just to get rid of any tension. So it's always good to periodically stop and just move your body and just let anything that you've been keeping drop away. Now, we're going to very slowly turn over. I'm going to come onto my front, so I'm going to lie on my tummy. Now, you might recognise this next exercise from the coat hanger series, the coat hanger pain, because we're going to do some baby extension. Now, some people need a cushion under their hips. If your lower back sort of collapses a lot, it helps lift your pelvis up a little bit to keep your lumbar spine straighter. So feel free to put a cushion. Again, if you can put your hands here in this position, we're going to just rest our head in our hands. And I want you to wiggle your pelvis and just check that it really, again, is still heavy. So even though I've changed position, I still want my pelvis to be heavy on the ground. So I'm not sort of tensing and lifting my bones off the floor. I've got to let them go. My bottom muscles are not engaged, okay? So this is soft. Okay, so we're going to wiggle the pelvis. Now remember, this is also a small movement. My bottom ribs do not come off the floor. This is fantastic for strengthening the upper back and the neck. So it's also not a push-up. So I'm not pushing with my arms, okay? They are just relaxed. So here we go. Heavy pelvis. Take a breath in. Just settle on the exhale. Let your belly be soft. Let your hips be soft. Next time you inhale, keep looking down at the floor. Do not change your neck position. Lift yourself a couple of inches off the floor. You should still be looking down at your mat or at your hands. You should not be looking in front of you. So that will keep your neck in a good position. And then soften and go back down. If your shoulder muscles and arm muscles are trying to get involved, don't worry, that's normal. We just have to keep working and changing those habits. So as we inhale, think you're going to inflate your body. Inhale. If you inflate something, it's going to come up. We're going to deflate as we exhale. And we're coming down. Inhale to come up. Exhale to go down. If your bottom muscles are trying to get involved, that is also a normal response. We want to try and keep them relaxed for this particular exercise. Okay, so we don't need our glutes to do this one. Okay, try one more time. Keep those bottom muscles relaxed. Inhale. And exhale. And then just totally relax. Very, very slowly, we're going to come into child's pose if that's comfortable for your knees. You can take your knees slightly wider and think of widening your pelvis and just sitting back. Again, if this isn't comfortable, come into maybe a cat, just something to let your lower back have a little flexion. So however you want to achieve that. Again, obviously look after your knees. So just again, in the child's pose position, can you let your pelvis feel heavy? So can we still drop the pelvis? So if we're doing that, that requires a release of the lower back so that the pelvis can drop towards the feet. Even we're going to take a seat. So, coming to the end of the class now, I hope you've enjoyed it. Find a comfortable seat. I'm sitting cross-legged, you don't have to sit cross-legged. I forgot to say I've got my stripes on today for EDS and HSD awareness. So I hope you're wearing your stripes too. So find wherever you're sitting, think about what we've done today. We spent a lot of time on our back. We talked about awareness of the shoulders and awareness of the pelvis and this rolling action of our joints, our shoulder joint and our hip joint. So as you sit, you can close your eyes if that helps. Can you still feel the heaviness of your back of your body? Can you still feel the weightiness of your shoulders? Yeah, do they want to creep up here and round forward? Can I feel them a little bit heavier? So just let them drop. Again, it's work in progress. Don't worry if this is like, no, I don't feel that. That's okay. Come back to the video again. The more you do it, the more you'll become aware and things will really start to change. Sorry, I can't read the comments, A, because I haven't got my glasses on as well, so that doesn't help, but I will look at them later. Now, can we also feel the weight of the pelvis? Remember, we lay on our back. We talked about the pelvis being very heavy. So as I'm sitting, can I still feel that? So just take a moment, see if you can feel that. Just let the breath settle into your pelvis. Good. Now we're going to try, we've done some spine articulation with our bridge. We're going to do a little bit of rotation, a little bit of side bending. So we moved our arms quite a bit at the beginning of class. Can you still bend this elbow, just one elbow, like we did when we were lying down? And can you start to float it up? Now remember, this shoulder blade is going to get heavier. Doesn't matter if you can't fully straighten it. I'm just going to go to there. Okay, so even if you're here, it's okay. And we're just going to gently lean to the side. If you can't lift your arm, and I know some of us find this quite challenging, just put your hand here. And you're just gently moving to the side and back to the middle. You're going to stay on the same side. We're just going to go to the side. See how that feels. What I'm not doing is lifting my pelvis. Okay, so I'm not rocking. I'm just bending very slightly, just getting a bit of movement. If I got my arm up, it's going to look like this. Okay, then we'll do the other side. It might feel different, of course. I'm going to start with a bent elbow, heavy, and I'm going to float it up wherever, or I'm going to put it here. Okay, doesn't matter. What does this side feel like? Can I go away from the center to the side? Is it tighter? And can I come back? It's not about who's got the biggest range. All we're thinking about is finding that awareness. What does it feel like to move my body to the side whilst keeping my pelvis heavy? And back. Very nice. Okay. A little bit of rotation. I'm going to take my left hand, put it on my right knee. So I'm already slightly rotated. If I want to go further, I'm just going to move the right hand slightly behind me. And I'm just going to breathe for a moment and just feel that gentle rotation. And then just to finish that, I'm going to take the right hand and I'm going to go back to that little side bend. So I get this little gentle twist and a bit of rotation. Then I'm coming back and coming back. So, other hand to the opposite knee, gentle rotation. Let your head join in, so don't jam into your neck, but gently follow with your eyes. Check that you're still centered, so you haven't started leaning. Okay, I'm still balanced in the middle. And I just breathe. And then I'm going to take this other hand, I'm going to lean over again, just to get a bit of opening through here. And then we're coming back, coming back, coming back. Back to center. Just find your center. Let's just lift those shoulders up as we inhale. Just like we did lying down. As I exhale, we're going to slowly release them. So it's not me pushing with my arms. I'm thinking of lifting the shoulder blades up and exhaling soft and heavy. Inhaling up. Exhaling down. One more time. Inhaling up. Exhaling down. And then we're just going to sit, if it's comfortable for you, just for a second. Just coming back to our breath. So in an upright position, is your breath still very quiet? Remember, we're not moving, we're just sitting. We don't need a lot of air. We're just gently breathing. Don't need a lot. Is the pelvis still connected to the ground? Is there any residual tension holding on? Very good. Now when you open your eyes, if your eyes have been closed, I want you to do so thinking of a very soft gaze. Okay, so the eyes themselves are going to feel soft. So just slowly open the eyelids. Just look down wherever your eyes happen to fall. Try and think of releasing tension from the face by having a very soft gaze. Makes a different quality. And remember, the eyes are connected all the way down into the occiput. So if you suffer from pain around your occiput, and I know a lot of us do, the eyes are connected all the way down there. So if I've got to stare at my computer screen a lot, and I've got a very harsh glare at my screen, that's going to be putting tension all the way down into the back of my head. Okay, so learning to look with a soft gaze, it seems like a silly thing, but actually it helps release this muscular tension. Okay, so just a little thing to think about. So I hope you enjoyed that class. I certainly feel better for doing that. So I feel really, really lovely and able to relax into the floor. So if you did enjoy that, that was actually from one of my online courses called the Integral Movement Method, which some of you know. My method is called the IMM, the Integral Movement Method. And that was the first lesson from the foundation course of the online course, so the IMM Foundation. So for the month of May, I've got a very special announcement now, just for the month of May 2022. That course is a 5-lesson course. And this one actually has got very gentle, relaxing music in it. So the classes got some very lovely, soft music in it. So this is a 5-lesson course, so 5 30-minute courses, and it also has lots of other materials that come with it because it's a course. It's similar to the Hypermobile Core course that probably many of you have got in its structure. Okay, but it's purely on the IMM. So although it doesn't talk about hypermobility, it's going to be exactly in my method. I just don't mention the watch points for hypermobility. So for the month of May, if you would like to take advantage and do some more of this kind of work at home, visit my website, jeanniedebon.com, and when you get to the checkout, if you purchase that course, so you follow the signs for IMM, and if you get to the checkout, in the checkout box, put EDS May 2022. That's EDS May 2022. That will give you a very special discount. So actually I'm taking 85% off of the price of that course. So it retails at £59, but it's actually, for the month of May, it's £9. So 5 lessons for just £9. So absolute bargain. And it's all about the IMM. Again, you don't need any equipment for it, so it'll be like today. But yes, that was my special offer. So EDS May 2022, visit my website, IMM Foundation. There is a performance one. We're doing the foundation one. Now, each lesson gradually builds up on the last lesson. So it's a gentle progression, but you can take it's no one's saying you have to do it week by week. You can take as long as you like. Once you've got it, it's yours to keep. Okay, so you can have it forever. You can have it on your sign in on your mobile, on your desktop. It's yours to keep. Okay, so you can take as long as you like, progressing through those 5 weeks. Okay, so that's just a special from me. So probably, I think I worked it out as 85% discount or something like that, just for this month to help celebrate our EDS and HSD Awareness Month. So I hope that's useful. I hope it will help you do some lovely movement therapy at home as well. So in the meantime, I will either see you there on the online course, or I will see you the same time next month. So the first Thursday in June, we will move again together. Again, we'll have some more education next time. But thank you all for watching. There's loads of you watching today, so thank you so much. I really appreciate it. This will be on the channel. You can watch it back anytime. Have a great day. Have a lovely evening, and I will see you all soon. Thank you. Bye-bye.